How to survive a stroke. What if you're alone? A stroke is also called a CVA, or cerebrovascular accident. In this video, I'm going to give you 6 tips, 6 steps you should follow that will greatly increase your chances of survival. And also 3 things you should never do because they increase your risk of complications or even death from a stroke. So you should also pay close attention to these things here that you should never do. According to the World Health Organization, WHO, approximately 7 million people die every year because of strokes. So it's extremely important that you pay close attention to all these tips and follow them. Look at that, 7 million people, and many of these deaths could have been prevented. First, I want you to learn how to recognize the signs and symptoms so you can take the right actions. It's no use if you don't know exactly what the symptoms of a stroke are, because then you won't be able to take the necessary steps. So I've listed 7 signs and symptoms of a stroke for you to know and be aware of all of them. And then I'll talk about what to do and what never to do. Deal? What are these 7 signs and symptoms? And sign number 1 is a loss of strength. And this loss of strength shows up suddenly, all of a sudden, and it sets in quickly. And it typically affects one side of the body. For example, in the left arm and left leg, or sometimes just the leg or just the arm. But typically it affects just one side, not the left arm and right arm together, for example. Together, for example, it's always on one side. That's a key characteristic. And another striking feature is that it happens quickly. And this loss of strength can be either total or partial. You might lose movement completely, or you might just notice you're weaker. This is a sign of a stroke. The second sign is a loss of sensation. And this loss also follows the same pattern. It happens quickly, suddenly, and usually on one side of the body. It could be a change in sensation, like tingling. You don't feel things properly. Or it could even be a total loss of sensation. That can happen too. But if you notice a sudden loss of sensation, that's also a medical emergency because it could be a stroke. The third sign of a stroke is a change in speech. And with this change, the person might not be able to speak at all, which we call aphasia, but also there might be a change in the way the person talks. Sometimes they might slur their words, have trouble speaking, or want to talk but just can't. So that can also be a sign of a stroke. You might be thinking, but the signs and symptoms are really varied. Actually, it depends on which area of the brain is being affected. Because in a stroke, we can have a change in blood flow to the brain due to a clot. The area gets blocked and blood flow and oxygen can't reach it. Or we can have bleeding, which is called a hemorrhagic stroke. And when it's a blockage, it's called an ischemic stroke. Most of the time, it's an ischemic stroke, about 80% to 85% of cases. The other type is hemorrhagic stroke, which is caused by bleeding. That's why the signs and symptoms are so different. And the fourth sign of a stroke is a change in balance. So changes in walking, the way the person walks, if they're less steady, having trouble keeping their balance, depending on the area that's affected, this can also happen, but a change in balance. I'll never forget when I used to work in the ER, a patient came in who had a change in balance. The way he walked was off and his speech was slurred. And his family thought he was drunk, but he hadn't had anything to drink, not a drop of alcohol. So what was going on? He was having a stroke. So remember, this can happen too. And the fifth sign is difficulty understanding. If the person can speak, move well, has strength, has sensation, but can't understand what's being said. So depending on the area affected, this can also happen. So for example, the person might be mentally confused. If this happened all of a sudden, it's also a medical emergency. And you should always consider that it could be a stroke. And sign number 6 is a change in vision. If you suddenly have a change in vision or having trouble seeing, blurriness, or cloudy vision, this can also be a sign of a stroke. And sign number 7, the last one, I want you to know there are others, but I want you to really remember this one, is a change in the mouth. The mouth may droop to one side. When the person smiles or talks, for example, if you notice this, or if you notice what we call a deviation of the labial commissure or deviation of the mouth line, which is when the mouth becomes crooked, this can also be a sign of a stroke. And also, it requires a lot of attention. It's a medical emergency. If you recognize these signs and symptoms, what should you do? I've listed 6 steps here that could save your life. So pay close attention. And the first step, the very first thing you should do, is sit down somewhere safe. If you're alone or doing something, like if you're near a staircase or if you're doing some activity, even just a simple household chore, you should stop what you're doing, and the first thing you need to do is sit down in a safe place. But I heard that the first thing to do is call emergency services, call for help. No, the first thing is to put yourself in a safe place, okay? Why? Because many times you might faint, you could lose consciousness. Imagine you're somewhere that if you could fall, hit your head, or have some other complication, right? If you're standing up or near a place that's not safe. So first thing, sit down. Second, you call emergency services. You call an ambulance. Why? Because when it comes to a stroke, time is crucial. The sooner you get to the emergency room, the much greater your chances are. So you call emergency services. And still, as part of number 2, I want to highlight a very important step here, which is to notify your family members. Call emergency services and notify all the family members you can reach. And you might be thinking, but what if I can't call, if I'm not very coordinated? Is there a way? There's a feature on your phone, probably one you don't know about, no one's ever told you, but it could save your life. So I'm going to talk about it for 2 types of phones. First for iPhone, then I'll explain for those who use Android. If you have an iPhone, there's a heart-shaped app that comes pre-installed called the Health app. In this mobile app, you can easily add your emergency contacts. If you have, in any emergency situation, you can press the volume button together with the power button on your phone. If you've registered these contacts, the phone will automatically alert them. And along with that, it will send your real-time location. So it's really important that you enable location services for this app because otherwise none of this will work. You might have registered your contacts, you might have the app. You can even use the command I mentioned, but if location isn't enabled, it won't work. And it's also important to enable the function that unlocks the phone for this specific section because many times, as I worked in medical emergencies, often in ambulances with ambulance doctors, we would arrive at the scene, but the person was unconscious and we couldn't contact anyone because the phone was locked. So you also need that. And take care to properly set up this function, which is the SOS feature in the Health app. If you have an iPhone or if you have an Android system, it also has this feature, though it's a little different. I want you to know about this too because it could save your life. You should go to Advanced Features and find SOS Message or SOS Contact. You will register the contacts you want to be notified in case of an emergency. And if you press the phone's power button 5 times, it'll activate. These contacts will receive a photo from the front, a photo from the back, your location, and it will also record audio. So that's really interesting too. And for this to work, your location service also needs to be turned on. That said, let's move on to step number 3. So after you've already called for help and you're in a safe place, what should you do next? You should unlock the doors. That's step number 3. because there's no point in calling for help. If you can't open the door, we won't be able to get in. We won't be able to help you. This has happened many times, back when I worked in emergency medicine. And it's not always like in the movies where the doctor goes there, kicks the door, and it just opens. A lot of times it's one of those iron doors. Many times it's a door well equipped, secure. It makes things a lot harder. I know in the movies, if you can't open the door with a kick, sometimes the doctor jumps through the window and comes in like a hero. But in real life, that often doesn't happen, and it makes it much harder to get inside. So this is not the time for you to worry about someone breaking into your house, for example. Ideally, you should leave the doors unlocked without a key, so it makes it easier for help to get in, makes it easier for you to get assistance. That's step number 3. So don't forget about that. Step number 4 is to write down or record the time when the symptoms started, because that will change the treatment. Depending on when the symptoms started, you might receive a treatment that can even reverse the symptoms, if it's indicated, or not. In practice, many people don't know this timing, and that makes things a lot harder. The doctor can't just guess and give you medication by guessing when the signs and symptoms started, because it's not always possible to figure that out, okay? So write down the time it started. The very first time you felt it, because that will make a difference later on. It could even save your life and help you avoid a lot of after effects. Step number 5 is to bring your medications with you. If it's a digital prescription, take a photo of it if you don't have the physical copy. Nowadays, a lot of people don't have a physical prescription anymore. It's only digital. But you need to take a photo of the prescription and keep it on your phone, or else print it out. It makes things much easier, because sometimes your phone is locked, and depending on the medication someone uses, certain treatments might not be possible. This can really vary. And I want you to have your prescription. If that's not possible, at least have the prescription on your phone, or else bring the pills with you, because that'll make things a lot easier. If you're a companion or with someone who's having a stroke, also bring their medications. Either a photo of the prescription or the physical prescription. Ideally, the physical prescription. Take some time and make a copy of the prescription. This will really help a lot. It could determine whether you get this thing, whether you'll survive in the future or not. What I'm saying here is very serious. And number 6, after you've done everything I've mentioned, you're sitting in a safe place, waiting for help, you're going to do the breathing technique, which is step number 6, before what you should never do. This is also extremely important. I'm going to teach you this breathing technique. This will help oxygen reach your brain properly and will also prevent panic, hyperventilation, or overbreathing. Because when you breathe too much, you can even faint. And then we have another situation that could get worse. And if you're thinking you might be having a stroke, a cerebral hemorrhage, what could happen? You might panic, and that can make everything even worse. So it's important that you do this breathing technique, which is step number 6. How does this technique work? You're gonna breathe in for 4 seconds, hold your breath for 1 or 2 seconds, and then release. Exhale for 6 seconds. This will help you and prevent hyperventilation, which is when you breathe too much. And there's a complication, which is that you panic. So that's step number 6. And what you should never do as an emergency doctor, for many years I handled these emergencies in the Red Room, let me tell you, these are the main mistakes that greatly increase the risk of death even. All right? What's the first mistake? I have the 3 most common ones. The first mistake is taking some medication thinking that this can treat or prevent a complication. A lot of people take ASA or aspirin. If it's a stroke, if you suspect it, you shouldn't take aspirin. Why? If it's a brain hemorrhage or a hemorrhagic stroke, this can make the symptoms worse. It can worsen the bleeding. And it can even make many treatments impossible. So don't take aspirin if you suspect a stroke. When it comes to a heart attack, that's a different story. I can even make a video about that later. But since we're talking about stroke, don't take aspirin. Also, don't take blood pressure medication. That's another very common mistake. All of this falls under mistake on the one. Number one, something you should never do, okay? So don't take blood pressure medications. Why? Because when you're having a stroke, naturally, the body may raise your blood pressure to try to control it, to try to reduce the area that's not being supplied. That's the body's mechanism to raise blood pressure. And if you lower that pressure to normal levels, for example, you could increase the risk of complications. So also, don't take blood pressure medicine without a doctor's recommendation, okay? Or take a double dose of the medication. It's very important if you suspect a stroke that you don't take aspirin or blood pressure medication on your own. Agreed? And not other medications either, like Iserdil, for example, or medications to lower blood pressure. It's different with a heart attack. That's a separate case. Like I said, if there are a lot of requests, I'll make a video about that. The second thing you should never do is wait for the signs and symptoms to go away on their own. If you suspect a stroke, that's a medical emergency, and you can't wait. A lot of times, this will get worse. There's a situation called a transient cerebral stroke or transient ischemic attack, or TIA. What is that? It's the kind that comes on and then quickly goes away. There are a few definitions, I won't get into that, but it's when you have those symptoms I mentioned and they get better on their own. Did you know that among people who have this transient type, 20% of the time, within a short period, they'll have a stroke? So you can't ignore the signs and symptoms. And a lot of times, you're actually having the beginning of a stroke, which can be treated, which can be prevented. So don't wait for the symptoms to go away on their own. Follow the steps I mentioned earlier, okay? And the third thing you should never do is test your strength, test your abilities. If you notice that you have reduced strength or a change in sensation, this is not the time to test it. Like, oh, I'm going to see if my leg is working well, if I can walk fine, then you try to go upstairs or do some activity. No, you should sit down and rest. This is not the time to test yourself because sometimes you might end up having an accident doing that. And this happens very often, like, oh, but I saw I wasn't doing well and I wanted to test myself, I wanted to push myself. No, this is not the time. That can make your signs and symptoms a lot worse. And did you know that there's a habit, there's something you can do that can reduce your chances of having a stroke by up to 40%? Do you know what can help prevent it? A stroke, a cerebral hemorrhage, by up to 40%? There's a really simple way. It's a habit you should have, and it can really help prevent this. I've already made a video about this, about how to prevent a stroke and the signs and symptoms that can show up even a month before you actually have a stroke. I'm going to direct you to another video, and I suggest you watch it to learn how to prevent a stroke and also how to recognize the signs and symptoms up to a month in advance. If you click here, you'll be taken to that video. I hope you enjoyed it. Don't forget to mention your city. I'm speaking from Porto Alegre.